Now, medics at the Namboole Isolation Center are concerned that if reluctance of following the SOPs continues, there might be a sharp rise in the infections. Now, Kanari Mugume is at Namboole to share with us an update. Over to you, Kanari. What's happening?
Thank you very much. In my background is the non-traditional isolation center, or what you can call a facility. Because what happens is that if you are asymptomatic and you're unable to get a room where you can isolate yourself from home, then you are admitted here for quite some time. And when you get better, then you are discharged. If the condition gets worse, then you are admitted into the hospitals, regional hospitals and other health facilities that have been put in place, make sure that they manage the COVID-19 situation. Now, this facility here has a bed capacity of 800, and so far they've registered some great success. Currently, they only have about 95 patients inside there who are, of course, not in critical condition at all, but just want to get better and are on medication. They have so far admitted 1,840 since the 9th of September up to date, and they have discharged 1,750 patients, and 53 patients have so far been referred from Namboole to Mulago and other management centers. Therefore, I want to connect to Dr. Chisula Ivan, who is the in charge of this facility. Thanks for joining me this evening. Let's begin from understanding the way this facility works. Yeah. How do you get to admit someone?
Yeah, thank you very much. So, as its name says, it's called Namboole Non-Traditional Isolation Facility. So it's non-traditional in the sense that it's not the typical hospital setting like Mulago is, and it's not the home where the person comes from. So the kind of patients who come here are those who are positive for COVID-19, but they either have no symptoms or have mild symptoms, and they cannot stay at home for one reason or another.
So do they need a referral letter from the facility where they tested from, or as long as I have positive results and I cannot isolate from home, and I do not have, and I'm asymptomatic, I can just come in here and I'll be admitted?
Yeah, so our patients come in from different corners. So as long as someone has a positive result, and the good thing is that we have an electronic system, which is the result dispatch system. So someone can actually come here, and so long as they know they are positive, we can retrieve their results from the system. So we don't need to have a referral letter to come here. So long as someone is found to be positive. Some people come from work, others come from home, others we have refugees who are coming from different camps. Okay. So patients are coming in from different parts of the country.
Okay. Dr. Chisula Ivan, right there, who is the in charge of the Namboole Non-Traditional Isolation Facility. Back to you guys at Mulago Hospital for the joint bulletin on COVID-19.
Well, thank you very much, Kanari. Like most of us, we've had our challenges following the SOPs. Personally, it's been a mask from time to time. I have been coming out of the home without a mask, and I have to go back and find a mask. But I think that this could not be the case if by any chance I would be able to see more promotional material or awareness material that reminds me that COVID-19 is real on the streets, as opposed to seeing more campaigning materials, because that's the situation right now. I think we ought to have more awareness material. What do you think, Rita?
One of the other things is also remembering that as you might want to hug your loved one after coming home from a busy day, or when you meet a friend and you really, really want to show them how much you have missed them, but you can't actually hug them because remember, a social distance. If you really love someone, keep that distance. That's one thing that has not been easy, but it's something that needs to be done. What about you, Lydia?
Well, I think the most important thing right now is to follow the SOPs. We have been given the tools to actually fight this virus, but it's just people are becoming a little bit negligent. It is up to us to fight for what we need, and what we do is need health.
There comes a time when you hear a certain call, when the world must come together as one. There are people dying. It's time to lend a hand. Lend a hand by wearing your mask. I mean stubborn you. Wear your mask. Now the four of us return right after this break.